Hello, guys. Thank you for spending a time with me in this virtual presentation that I'm going to present to you. So basically, today topic is about dengue fever. I know that a lot of you already know what is dengue fever, but via this presentation I'm going to explain more or less about the dengue fever. So before that, I'm going to introduce myself as whoever, as if you don't know me. My name is Refa Asarela Jaimis. As you can see, I'm the student of Bachelor of Medical and Health Science in OUM, and I am Assistant Medical Officer in this Emergency and Trauma Department. So let's go through with the dengue fever. What is a dengue fever actually? So a lot of you can say that dengue fever is some kind of infection that causes fever. And yes, of course, one of the symptoms is fever. So a dengue infection is caused by a dengue virus, which is the mosquito-borne flavivirus. So the two types of mosquito are the Aedes aegypti and Aedes albopictus. Other than this, mosquito is not associated with the dengue infection. So you must get transmitted by these two Aedes, or either two of these Aedes, to get infected with the dengue infection actually. So yes, this is figure 1, show a dengue incident rate and case fatality rate in Malaysia from 2000 to 2004. The blue line indicated as incident rate, which you can see that from the 2000 to 2014, the graph show increasing in number of incident rate of patient having that dengue. And the red line indicates as the case fatality rate, the mortality. So from the highest at 2000 shows decrease in 2014. So maybe this actually a very good graph, because you can see that by this you can see our management is actually pretty good, as it decreasing the mortality rate in Malaysia. But dengue incident is still ongoing until today. There is no other specific thing that could, vanish this dengue incident in Malaysia. So next is a clinical manifestation. So what is a clinical manifestation? This is basically all about the symptom when you are getting dengue infections. So these are the critical phase, clinical manifestation, which often occur 24 to 48 hours after the third day of fever, or may occur earlier or around difference with a rapid drop in temperature. So don't assume that having a dengue fever, you having a fever. No, at the critical phase, you will have a rapid drop in temperature. So clinical deterioration often occurs during the critical phase. with plasma leakage or organ dysfunction. So, what is the evidence of plasma leakage? So, you can see it through the result of full blood count. So, you can see that hematocrit, HCT, is raised, and you will soon get hemodynamic instability, fluid accumulation, and extravascular space or hyponatremia, hypoproteinemia. Next. So be careful on the clinical warning sign of the dengue infection, which are the abdominal pain, you have a persistent vomiting or diarrhea, which is more than 3 times in a day, and then having a restless, altered conscious level, clinical fluid accumulation, and when you palpate the abdomen of the patient, the result are tender liver or having a mucosal bleed. Of course, it is a spontaneous bleeding tendency. When patient having this clinical warning sign, they have the high possibility of rapid progression to be severe dengue. So we go through to pathophysiology. Pathophysiology is the story of a dengue fever in our body if we got infected. So an acute increase in vascular permeability that leads to leakage of plasma that I've already told you before into the extravascular compartment, resulting in hemoconcentration and hypovolemic or shock. So when we have this shock, we will have a tachycardia and generalized vasoconstriction due to the increased sympathetic output. So this will cause an inadequate perfusion to the tissue, leads to increased anaerobic glycolysis and lactic acidosis. So if the hypovolemia is not corrected promptly, the patient will progress to refractory shock state. When you are in a refractory shock state, the tissue perfusion will not respond to any vasopressor drug, such as noradrenaline, adrenaline, dopamine. Even if the blood pressure and intravascular volume were to be restored, and cardiac output will remain depressed. So the result, lactic acidosis, further depression to myocardium, and worsen the hypotension. So of course, the prognosis, if dengue fever is treated accordingly and early with fluid and a proper management, of course it is curable. It can be cured. But if it is not, of course the prognosis is bad, because you will have a prolonged shock, a massive bleeding, disseminated intravascular coagulopathy, and multi-organ failure, and of course can cause to death. So what is the management for adults? Of course, we will go for admission for daily full blood count if patient in a critical phase, 4 to 12 hours of MBC taking, and repeat before and after fluid resuscitation. For blood urea serum electrolyte, BUS is indicated for daily. And you can monitor arterial blood gas test, ABG, if patient in a critical phase, but also if indicated. Other investigations such as lactate coagulation, troponin, fibrinogen, ferritin, echocardiogram, and ultrasound can be done as clinically indicated. So, before fluid therapy, you must obtain the baseline of hematocrit in FBC. And then maintenance fluid crystalloid can be given 0.5% of normal saline, starting with 5 ml per kg per hour for 1 to 2 hours, then reduce to 3 ml per kg per hour for 2 to 4 hours, then reduce to 2 ml per kg per hour according to the patient clinical response. If in a good response, and then you can maintain the fluid given in 1.2 to 1.5 ml per kg per hour. Be reminded to monitor fluid input and urine output, because we already give the patient too much water, so we must monitor the fluid intake and output. So if clinical parameter is worsening and hematocrit is rising, increased rate of infusion, then you must reassess clinical status. If patient having bleeding tendency, just prepare for blood transfusion. Maintain the oxygen 90%. Of course, monitor vital sign and medication as served. Yes, of course, dengue fever, they don't have a specific medication, but we can still overcome any symptomatic condition with a medication such as paracetamol if patient having a fever. So this is actually an algorithm of fluid management in compensated shock. So by this actually, compensated is when you don't have any symptom of the disease, but you still are considered to be have. So these are the management of fluid resuscitation that should be given to the dengue patient. And always check for improvement, check for hematocrit, and always consider if there is a significant decreasing in hematocrit, you should initiate transfusion with fresh blood. But if hematocrit is high, you can administer second bolus of fluid colloid, which consists of 10 to 2 ml per kg per hour for 1 hour, and then check for improvement. If there is an improvement, you can reduce to 7 to 10 ml per kg per hour for 1 to 2 hours, then reduce further, and then go back to the other management of crystalloid. The algorithm B is a fluid management for decompensated shock, which already you have trouble functioning. This is a decompensated shock. So the algorithm is the same. You must search for improvement, giving crystalloid and revideo hematocrit. So you may consider a significant blood transfusion if hematocrit is low, but if it is high, you can administer second bolus of fluid colloid with 10 to 20 ml per kg to 1 hours. So search for improvement. You can just see this algorithm. This is a basic thing that you should know. And for algorithm C is the fluid management in decompensated shock with presence of bleeding and leaking of other cause of shock. So for algorithm C, when you can see that the hematocrit is unchanged, refer to the algorithm C, which you may consider to find what cause of the shock. Maybe a septic shock, a bleeding and leaking at the same time, or the patient have a cardiac dysfunction or liver function with severe metabolic acidosis with lactate accumulation, or cytokine storm. So find the cause of shock and then reverse the shock back and continue on managing the patient with fluid resuscitation. Management for pediatrics are the same. It's the same, but hematocrit above than 38 for pediatric is considered as hemoconcentration. But if no baseline of hematocrit available, you can give IV drip if patient having a poor oral intake. Then if the hematocrit is above than 40, IV drip normal saline 3 ml per kg per hours can be given and tapered down if good oral intake and passing urine well. So blood investigation such as FBC, platelet, hematocrit should be done 6 hourly during febrile phase and 4 hourly if hematocrit is more than 38 or with warning sign. For the compensated shock, just refer the compensated dengue shock flowchart at algorithm A. And dengue patient may leak intermittently, so drip rate needs to be adjusted every assessment 1 to 2 hours. So avoid keeping drip running at 5 ml per kg for a prolonged period. So there's a bring home advice for you all. Because this dengue is a dynamic disease, so it's a trend. So things keep changing. They're changing. That's why we need to review the patient frequently. Always look at the patient, touch, feel, listen, and correlate patient clinically. Always check vital sign trend. Don't forget pulse pressure. And always see result as a trend, especially in hematocrit, TWC, platelet. Don't forget the HB. Hemoglobin. Always screen for complications such as liver, kidney, and all investigation. Review all investigation before admitting the patient or give a plan. Delicate balance between shock and overload, especially fragile patient like peds, elderly, pregnant, and patient who have comorbids. Please don't manage it alone. So actually we came to the end of my lecture about dengue fever, but I've put some extra information in my slides about the myth, the question that are being asked from Malaysian about getting the dengue fever. Myth, okay? So the first myth is, I will get dengue fever if any mosquito bite me. The answer is dengue fever is a disease caused by a dengue virus infection, a genus flavivirus that is spread by female Aedes mosquito. So other than this mosquito, you wouldn't have the dengue fever. The way it is spread is through the bite of Aedes mosquito over people with dengue virus to the healthy healthy person. The second myth is only children, older, and pregnant women have the risk of getting dengue fever. Everyone, regardless of age, gender, or socio-economic background, is at the risk of getting dengue. Everyone, each and every one of us. So you don't have to say that it is only for children, older, or the pregnant woman, but potentially have devastating effect on those with chronic disease such as high blood pressure, diabetes, and obese. So the third myth is, I'm not at risk because my house and surrounding is clean. Actually, for this question, it's as long as there is a breeding ground for mosquitoes, enough stagnant water in a size of 50 cents, Aedes mosquito can breed and even live with you. Small amount of water, they can breed 100 of larvae actually. Mosquito can also fly from your neighbor's house from 400 meters area. So if your house is clean but your neighbor house is not clean, you have the high probability to get. This is actually a traditional myth where everybody said that 100 plus is the management of dengue fever. Actually 100 plus, it is isotonic water, but it consists of higher sugar intake inside the 100 plus. So when we taking it in a large quantity, it will cause us to frequent urinating because of diuretics, and because of a lot of diuretic, a lot of urination can cause your body to become weaker. But it is important for us to drink plenty of plain water for hydration, of course. I live in a high apartment, so I will not get dengue. No, don't assume that mosquito cannot go up to the highest apartment. They can be in the elevator too, you know. So mosquito can still breed and spread dengue. Even on top of the roof where there is enough water for them to breed, they will breed. Myth number 6 is I need antibiotics to treat dengue. No, it isn't. Dengue is a viral disease and should not be treated with antibiotics. Furthermore, until now, there is no antiviral to fight this dengue. Myth number 7. One can only get dengue once in a lifetime. This is a no, because a person can get infected again with other strain. So don't assume that once you're already getting the dengue, you will not having it. You may have, but get infected by other strain. The 80th myth, dengue fever is similar to malaria fever. No, dengue is a different types of disease. It's not the same as malaria. Even the management of malaria and dengue are totally different. Malaria have their own medication, whereby dengue still don't have a medication. They're only for fluid management. There is a vaccine for dengue. If there is a vaccine for dengue, of course, everybody will not get infected with this infectious. There's no vaccine to protect getting dengue fever. No antiviral for now. It is the government job to control the dengue. This is probably is the main concern. Patients think that it is a government job to control. We as the government servant, as the healthcare provider job to control the dengue, but it is proven globally that this disease cannot be prevented or controlled well if there is no cooperation with various fields, including individually and the communities. And actually, with the help of individual and communities, it can help more and prevent more from getting dengue fever. So we have we as the community have a lot of active role to play. Just cooperate with everyone, every health authorities. This can overcome dengue fever. And thanks for listening, everybody. I know that I'm a bit late about getting finish my slide, but thanks for listening, and I hope you all enjoy and know more or less about this dengue fever. That's all. Thanks. Bye-bye.